Today, I'll talk about treatment methods for epilepsy from our personal experience. The treatment of epilepsy must be administered under the supervision of medical professionals. However, since the treatment of epilepsy tends to take a long time, the choices of methods vary according to the patient's physical condition, environment, family circumstances, etc. Today, I'm going to talk about some treatment options that we have considered in the past. In our previous video about epilepsy, I said that if a young child experiences an epileptic seizure, it is probably only once or a few times. Most children grow out of it eventually. However, some people continue to have seizures, and if it's difficult to control by medications, it's called intractable epilepsy. Even if a person appears to have grown out of childhood epilepsy, it may suddenly recur in adulthood. If such a person doesn't know how to respond to a sudden seizure, it can be quite dangerous. So, if a person has an epileptic seizure, he or she must thereafter keep it in mind just in case of recurrences. If a person doesn't have seizures for a certain period of time, then he or she may stop taking medications for good. But if a person continues to have seizures, or his or her EEG shows signs of epilepsy, even though the seizures are not visibly apparent, then the person must continue the treatment. So, taking medications is the first choice of the treatment of epilepsy. Other than medications, some people choose surgery. Claudio has never had surgical operations for his epilepsy, but we know someone with hydrocephalus, a rare condition in which some excess fluid builds up in the brain. A cerebral shunt is an effective treatment. It is placed so as to drain the fluid from the brain to the abdomen. Other surgical procedures include hemispherectomy or hemispherotomy, in which the right and left sides of the brain are surgically disconnected if the epilepsy occurs in one side of the brain and the other side remains healthy. It is typically performed when the patient is a young child. The patient may experience temporary paralysis on one side of the body, but as he or she grows up, the healthy side of the brain covers the functions of the other side. That's why it is preferable to do this surgery at a young age. Before Claudio was 2 years old, his EEG showed strong epilepsy waves coming from the right side of his brain. But the waves were also emanating from the left side of his brain by the time he reached 3. So the doctors decided that the brain surgery was not applicable to him. I have also heard of another type of surgery in which a device is planted in a patient's neck. The device may not be able to eliminate seizures, but it can decrease the number of seizures for those who have multiple seizures a day. None of those procedures were applicable in Claudio's case, so he has not had any neurological surgery so far. Another means of treatment for Claudio's epilepsy we have ever considered was the medical diet therapy. I had a bit of knowledge about this dietary therapy because I saw a movie starring Meryl Streep from the late 1990s. It was before Claudio was born. The movie was about a mother's journey to seek treatments for her young son, who was suffering from a very difficult case of epilepsy. Eventually, they found a therapy called the ketogenic diet. The boy successfully overcame his epilepsy and no longer had seizures after he started this diet. We considered the ketogenic diet once. At that time, Claudio was about 5 years old, and he could stand up and walk to some extent with assistance. We were worried that he would get hurt by having an epileptic seizure and falling down. So he used to wear a protective headgear. If he were to become more mobile as he grew up, with his mental disability, he wouldn't understand what kind of move is dangerous for him. What if he had an epileptic seizure at the wrong moment? We used to think that the seizures must be prevented as to whatever extent was possible. We may have been overly anxious about Claudio's condition. We did a lot of research on epileptic medication, surgery, and other treatments, seeking to find the best way to make him seizure-free. But the ketogenic diet is a very peculiar thing. It's been known from the times of the Romans and Greeks that if an epileptic person stopped eating and approached the state of starvation, the number of seizures decreased. The ketogenic diet cuts off carbohydrate completely. A person can't eat any sugar, rice, or bread, or even vegetables, as many vegetables also contain carbohydrates. Most of the calories one needs in a day come from fats such as butter and vegetable shortenings. Other parts of the diet consist of proteins and vitamins. In other words, a person has to give up eating normal foods. Preparing a meal requires knowledge and skill because the ingredients must be measured meticulously. The person must make sure that the meal contains sufficient vitamins and minerals to meet the human body's needs. That means if we were to learn how to do it, we had to live near a hospital which could train us. Claudio would have to transfer to a school near that hospital. It would take several months before we could master the methods. At that time, Claudio's father and I had jobs, and Claudio was attending a very good school. It was not easy for us to move to a big city which had such a hospital, and eventually we gave up the idea. If an epileptic person doesn't have physical disabilities, the choices of treatment would be different from those who have. What if he or she has a sudden epileptic seizure when walking by a street where lots of cars are passing by? What if he or she has a seizure in an important job meeting or an entrance examination to a high school or university? We understand that they could be more desperate to control the seizures. We used to be there too. In case of Claudio, he became unable to walk as he grew. His deformed legs can't support his body. His means of moving around is crawling on a floor or sliding on his bottom. will probably never stand up and walk, so he no longer falls and injures himself. Because of his disability, there's always somebody who's watching over him. He has also learned to go to futon or cushion and lie down if he feels he's about to have a seizure. Besides, the cycle of his seizures is quite periodic and easy to predict. In a way, we are not scared of epileptic seizures anymore. We have learned to live with it rather than eliminating it. So that was our story of choosing the treatment for Claudio's epilepsy.
チャンネル登録と高評価よろしくお願いします。